Hello and welcome to this dermatology recall session of August 2020 FMGE exam. So I'm Dr. Jazeer, your dermatology faculty, and I'll be discussing about the questions that has come in the August 2020 FMGE exam. So now let's begin with the first question, that is, which is the organism that is responsible for causing erysipelas? So you also got an image like this which shows that there is a patient of erysipelas. We all know that in erysipelas we have a very clear-cut border, and it usually affects the lymphatics as well. So erysipelas, which is a bacterial infection, is exclusively caused by streptococcus. So see the options: staphylococcus, pseudomonas, fungus and streptococcus. So the right answer would be streptococcus. Whereas in the case of cellulitis, it can be either caused by streptococcus or by staphylococcus. So now let's see the next question. A child presents with sores in the mouth and rash on the hands and feet as shown in the image. So what is a causative organism? So if you are getting a sore or a vesicle over the hand, foot and mouth, the diagnosis is hand, foot, mouth disease. So the most common organism that causes hand, foot, mouth disease is Coxsackie virus A16. It can also be caused by enterovirus EV71. But among both these causative organisms, the most common would be Coxsackie virus. So this is also a pretty much direct question. So among all these options, it is option D, that is Coxsackie virus A16, that causes hand, foot, mouth disease. So now let's see the next question. A patient suffering from ulcerative colitis presents with ulcer on the anterior leg as shown in the image. What is the diagnosis? So the options are chancroid, pyoderma gangrenosum, tubercular ulcer and a venous ulcer. So every time we get a non-healing ulcer, we may think about a venous ulcer, an arterial ulcer, a tubercular chancre or whatever. But in this case, there is a special mention about ulcerative colitis. So which is that disease that is closely associated with ulcerative colitis or rheumatoid arthritis. So all these kind, or some hematological malignancies. So all these are closely associated with pyoderma gangrenosum. So pyoderma gangrenosum is a neutrophilic dermatitis, and in this case we also treat the patient with steroids again. Okay, so the right answer here would be pyoderma gangrenosum, because this ulcer is associated with ulcerative colitis. So now let's see the next question. Child presented with fever and a pleomorphic rash as shown in the image. Options are smallpox, measles, rubella and chickenpox. So in this question, it is a child. Fever means it may be a prodromal symptom before the onset of the rash. And in which of these following diseases do we get a pleomorphic rash? So pleomorphic rash, that is rash in different phases, like be it a macule, be it a papule or a vesicle or some erosions. So different phases of rash is seen in chickenpox. So the right answer here would be option D, that is chickenpox, and the lesion that we are looking for in this case is a vesicle, and this lesion is also compared to a dew drop on a rose petal appearance. Now let's see the next question, that is a common complication associated with the following condition. Now you can see that in this image a face of a patient is given and there is some crusting as well, and this crusting, as you can see in the image, is golden yellow, honey colored as well. So which is that disease which causes a golden yellow honey colored crust? That is impetigo contagiosum. And what is a common causative organism? The causative organism would be streptococcus. So in the case of a streptococcal impetigo contagiosum, the common complication among all, like the options are encephalitis, pneumonitis, staphylococcal scalded skin syndrome and post-streptococcal glomerulonephritis. So in this case, the right answer would be PSGN, that is post-streptococcal glomerulonephritis. So now let's see the next question. Identify the condition shown in the image. So this is a spotter and they are asking you what is the spot diagnosis. The options are malignant melanoma, basal cell carcinoma, squamous cell carcinoma and a nevus. Now just concentrate on the image, that you can see that any black colored mole that is having some kind of an irregularity or asymmetry, we are going to evaluate it with the ABCDE algorithm. So there is an asymmetry, border irregularity, there is a difference in color. You can see the center of the lesion is black in color, whereas the outer part is going to be lighter in pigmentation. So A, B, C, and the diameter is also increasing, it is more than 6 mm. So based on the ABCDE algorithm, the most likely diagnosis would be malignant melanoma. So that is option A. So now let's go to the next one. Again a spot diagnosis, identify the condition that is shown in the image. So you can see that there are multiple exophytic rough surface growth outside the genitalia. So what do you call for genital warts? So options are condyloma acuminata, Bowen's disease, condyloma lata, and hemorrhoids. So genital warts are otherwise called as condyloma acuminata. So the right answer is option A. Now what is condyloma lata? You always tend to get confused between both these. Condyloma lata is seen in secondary syphilis. These are again some warty type of growth which is very much infective, that is seen in secondary syphilis. So here the right answer would be condyloma acuminata. Now let's see the next question. Cutaneous horn as shown in the image is associated with which of the following skin cancer? Options are squamous cell carcinoma, melanoma, BCC, and actinic keratosis. So out of all these options, usually for melanoma we have a dysplastic nevus and a giant congenital melanocytic nevus as a pre-malignant condition. For BCC there is no pre-malignant lesions. Actinic keratosis is usually seen if a patient is having a history of a chronic sun exposure. So the right answer here would be option A, that is squamous cell carcinoma, because squamous cell carcinoma is the one which has maximum number of pre-malignant skin lesions. Okay. So now let's go to the next one. Patient presents with a history of severe sunburn only after few minutes of exposure to the sun, and there is a freckling in sun exposed area, dry skin, and changes in pigmentation. So what is the diagnosis? Options are xeroderma pigmentosum, Bloom syndrome, warts, and a melanocytic nevus. So patient with photosensitivity, hyperpigmentation, freckling in the sun exposed area, dryness of the skin. So all these are hinting to a genodermatosis called as xeroderma pigmentosum. Kyunki xeroderma means it is a dryness of the skin and pigmentosum means there is a pigmentation that is happening. So the right answer here is xeroderma pigmentosum. So now let's see the next one. The first line treatment for acne comedones is. So options are topical steroids, topical antibiotics, benzyl peroxide, and topical retinoids. So we know that in the case of acne vulgaris, for all the type of acne vulgaris except the severe forms like the nodulocystic acne, in all the other forms the first line of agent is going to be a retinoid, and we prefer to start it with a topical retinoid. So out of all these options, it is not steroid, not antibiotics, not benzyl peroxide. The right answer would be topical retinoids. So the examples of topical retinoids would be adapalene or tretinoin. Okay, adapalene and tretinoins are examples of topical retinoids. The next question is Auspitz sign is seen in. This is a direct question. Where do you find Auspitz sign? Options are pemphigus vulgaris, psoriasis vulgaris, pustula psoriasis, and DLE. So Auspitz sign, when you scrape over the lesions in a psoriasis patient, if you get multiple pinpointed bleeding spots, this is called as Auspitz sign. So this is a direct question seen in psoriasis vulgaris, that is option B. So going to the next one, patient presents with the ulcer with overhanging or undermined edge in the neck area. So what is the diagnosis? So no other mention was given, it was simply a patient with an ulcer in the neck area. So out of all these options like tubercular lymph node, malignant cervical lymphadenopathy, syphilis, and reactive lymphadenopathy, the best one that suits all these options would be tubercular lymph node. Okay, in the case of a scrophulodderma and all, we know that there is a swelling. The most common site is the neck, and then you may also get a undermined edges, an ulcer with an undermined edge as well. So So the right answer here would be tubercular lymph node. Now going to the next question. Which mineral deficiency can lead to the following condition? The options are zinc, iron, calcium and vitamin A. Now what is given in this image? You can see that an image of a child is given where the child is presenting to you with periorificial dermatitis outside the orifice. Maybe it is outside the oral mucosa, outside the nasal mucosa, sometimes around the genital mucosa. So in all these cases where a baby presents to you with this kind of a dermatitis, it hints to a deficiency of zinc, and this condition is called as acrodermatitis enteropathica. So the right answer here would be zinc. So I think that is all about this recall session of August 2020 FMG. I hope this session has been useful to you, and if there is any change in the questions that you feel, you may also comment down in the comment box. So thank you so much for watching.